Now, today we'll be discussing about an important thing, and that is lactate. We will be discussing only about lactate today. So, in lactate, it has to be less than 2 millimole per liter. And if it is more than 2 millimole, what is the significance of this? That we'll be discussing today. So, we know that lactate is basically a product of lactic acid, and lactic acid is a product of anaerobic metabolism. So whenever tissues, this lactic acid is actually produced by each and every cell of the body. So normally the cell does not produce that much of lactic acid, that much of acidemia, so that the lactate always is less than 2 if it is normal. If it is more than 2, then actually it means very limited things. So as I've already told, that this lactate or lactic acid is significantly produced by each and every cell of the body. So if they have good aerobic blood flow, or if they have enough hydration, then this lactates actually remain in very, very good levels, or if it will be less than 2 millimole per liter. So one of the most important reasons why this lactate increase are very, very few. The one of the most important thing is hydration. If the patient is significantly dehydrated, if the patient has loose motions, vomiting, or because of any reason, if the patient has significant blood loss or fluid loss, that time there will be definitely poor perfusion of almost all the cells in the body. It will facilitate the anaerobic metabolism, and it will increase the lactate. So, inadequate hydration is one of the most common reasons. Second is presence of vasopressors or inotropic supports. Lactate significantly increase if the patient is on NORAD, dopamine, dobutamine, adrenaline, or vasopressor support or in vasopressor infusion. So if the patient has any of these infusions, more and more is the need of this vasopressor support, more and more will be lactate. So as this vasopressor or inotropic support reduce, then only the lactate usually reduce over a period of time. And the third reason where we can find significantly high elevated levels of lactate is when the patient has a very bad shock. That can be because of any reason. As I already told, that the patient can be put on NORAD, dopamine, dobutamine, adrenaline. These are very commonly put on post bypass patients also. That time the patient may not have shock, but just to have a good, better perfusing pressure, this vasopressor or inotropic support is put on in post bypass surgery or post mitral valve or post aortic valve replacement surgeries. And in very commonly, if the patient has a very bad shock, like it can be in dengue shock syndrome or septic shock syndrome or anaphylactic shock, or any reason because of which the patient is in very bad perfusional state, it can be because of trauma, it can be polytrauma, it can be significant blood loss, any reason where there is significant shock, where there is significantly reduced perfusion of the tissues. That can be because of low HB, that is low hemoglobin, or that can be because of low fluid, that can be because of low albumin also. So hypoalbuminemia or severe anemia or severe acute blood loss or significant dehydration, this very commonly cause this lactate acidemia or high lactate levels. So it's very easy to come to know why this patient has high lactate levels. We can simply check for IVC. If IVC is usually normally if the patient is adequately hydrated, we can see the IVC will be inferior vena cava on echo, 2D echo, or on ultrasonography of the abdomen. We can find 8 to 12 millimeters. And if it is collapsing, or it can be non-collapsing also. So if it is less than 8 millimeter, we definitely say that the patient is poorly hydrated, and we can definitely give more and more fluids. The patient can get albumin, the patient can get Volibin, Dextran, or IV fluids as well, and it can improve the lactate. So other things we can see for hydration is dry skin, dry tongue, poor dry turgor of the skin, IVC. These all things can definitely tell us about IVC or CVP as well. CVP and IVC, they almost match to each other. If CVP is less than 8, we usually say that the patient is pretty dehydrated and we can definitely consider IV fluids. For vasopressor support, more and more is the vasopressor support, lactates will be definitely high and high because the vasopressors cause significant vasoconstriction of peripheral arteries, especially of the muscles, especially of the gut, especially to the skin, and that definitely increases the lactate to a higher level. And third thing, if the patient is in very bad shock, that can be hypovolemic shock, that can be septic shock, that can be cardiogenic shock. Any reason where the patient is in severe shock will definitely lead to higher and higher lactates. So this is for all now, and thanks a lot for watching.